Got some ibuprofen in your medicine cabinet? And pain strikes, relief doesn't have to wait. Well, do you really know when it might actually do more harm than good? In this video, I'll show you the most important interactions, who should avoid ibuprofen, and how to use it safely. What is ibuprofen? It's ibuprofen, which is an NSAID, nonsteroidal anti-inflammatory drug, also known as Advil, Brufen, Nurofen, Padilla, Motrin. These are just a few of its brand names, and it's typically used for pain, fever, and inflammation. Safe and effective when used properly. It's one of the most trusted medications worldwide. Ibuprofen works by inhibiting the cyclooxygenase enzymes, which leads to reducing the production of prostaglandins, which are chemical messengers that promote inflammation, pain, and fever. Who should avoid ibuprofen and why? Because ibuprofen's mechanism of action is related to reduced production of prostaglandins. This leads to decreasing the protection of the GI mucosa against the harmful influence of the hydrochloric acid. So first group of people with history of stomach ulcers and GI bleeding, peptic ulcer disease, or any type of gastrointestinal bleeding, which includes your stomach, your intestines, your esophagus, your rectum, your anus, should probably avoid ibuprofen because it can make things worse. The next group of people who should avoid the ibuprofen intake are these, which have kidney diseases. Ibuprofen blocks prostaglandins, which are chemicals that help dilate blood vessels in the kidneys, allowing them to maintain proper blood flow and filter waste effectively. This can lead to acute kidney injury or worsen chronic kidney disease, particularly in people who are dehydrated, taking diuretics or ACE inhibitors, elderly, or have heart failure. Other people that should avoid usage of ibuprofen are these with cardiovascular diseases, especially existing heart disease, hypertension, or a history of stroke. Well, for the most part, ibuprofen is considered safe during pregnancy when used for a short period of time in the first and second trimesters. However, it is recommended to avoid it during the third trimester because it can cause constriction of the ductus arteriosus, which is a blood vessel connecting the aorta and pulmonary artery in fetuses and newborns. In people with asthma triggered by NSAIDs, now most people don't realize that NSAIDs, which include ibuprofen, aspirin, naproxen, can trigger asthma in some people, especially those who are allergic to aspirin. It's known as aspirin-sensitive asthma or NSAID-sensitive asthma. So now that we know who should avoid ibuprofen, let's move on to dangerous drug interactions. So when it comes to dangerous drug interactions, I'm going to focus on the ones that I think are most important for you to know based on my experience. And if you want to know more, always ask your doctor or your pharmacist. So number one, most important and most dangerous, medicines that influence the blood coagulation. It's other of the many NSAIDs like aspirin, diclofenac, naproxen, strong inhibitors of the blood coagulation like heparin. They prevent blood clots by reducing the ability of your blood to coagulate. Now, if you take ibuprofen with these blood thinners, it can increase the levels of the blood thinner in your body, and that means that you'll have a higher risk of bleeding. Now, number two, ACE inhibitors like telmisartan, valsartan, irbesartan, plus diuretics like furosemide, torsemide, and hydrochlorothiazide. Therapeutical combination of these three classes of drugs together can increase the risk of kidney damage and to rise concentration of serum potassium, which could lead to heart arrhythmia. Alcohol. Combining alcohol and ibuprofen can increase the chances of stomach bleeding. In fact, it can double the risk. Both alcohol and ibuprofen are tough on your stomach lining, and when you mix them, it can cause more damage leading to bleeding. How to use ibuprofen safely? First of all, stick to the max allowed daily dose, which is usually around 1,200 milligrams divided in 3 applications if you're getting it over the counter. It's better to take smaller doses more frequently to keep the levels of ibuprofen in your body steady and prevent too much from building up at once. Secondly, take it with food. Taking ibuprofen with food can help reduce the chance of stomach upset or bleeding. Next, don't use ibuprofen for more than 3 days if you have a fever or 10 days for pain, unless you talk to your doctor first. Ibuprofen might be your go-to for pain and inflammation, but it's not always the safest sidekick. Behind that quick relief are serious risks. Always check with your doctor or your pharmacist. I hope this video was helpful and you learned something new. If you did, give it a like. And if you have any questions, feel free to leave them in the comments below. We'll see you next time.